Hi there, I'm Carl Hanna, and together with Saurabh Vyas, we are the founders of Evva Health. And Evva Health is what we're building is a digital platform, right, centered around the family caregiver. Right? So you and I who's caring for a loved one at home, right, and center on the family caregiver and those loved ones to really change the caregiving experience for those families. So when we think about Evva, we think about three pillars, right? Creating that super highway between the physician and the family. But also, second pillar would be to bring the community close to these families by bringing the right community members, the right service organization from the community to support those families during their care journey. And the third piece is around changing the environment where those persons reside by using technology, by using AI. Wi-Fi sensing technology, IoT devices to really understand, what's happening on a day-to-day. And at times, that's not captured, during the different transaction or different conversation that the family has with those loved ones. So again, excited to be part
Wonderful.
of this investor panel.
I can hear that you have a lot of customer discovery, right? That has already gone on, and I would love to, if it's something that we can share, is how does a customer actually get so excited about the technology, so excited about the opportunity to learn in great community and also connect with doctors? Kind of walk me through what that looks like as a customer discovery.
Sure. Like I said, the family is really at the center of it all. So as we begin our journey, our emphasis was around, being close to these families and asking those questions. What are the pain points? We're also caregivers, right? So Rob and I are also caregivers for our parents and relatives. So understand the pain point that exists when, after you leave the doctor's office. Typically you're given a piece of a piece of information that's located sometimes on the patient portal or a printout, right? You all are familiar with multiple printouts that you
they usually get shuffled off into something, right? And then you forget, and then your mother asks you what's exactly next, and you're like, oh, okay, so go ahead.
I don't, it's like, I don't know, right? And, but thinking about when you're dealing with someone that's aging, right? Someone that has, dementia, which is one of our focus, right? That person relies a lot on the family members, and that family members, have to decipher, right, what was said in the doctor's office. So that's one. And then decipher it and figure out, okay, how do I create action item, right, to really, determine what I need to do today, what I need to do tomorrow, what I need to do in 3 months and 6 months, right? So Evva, it's around make it simple for you. Let us, capture your caregiving plan, right? Let us actionalize those instructions into action item, and let us help you stay on track, right? By bringing the right information, by bringing the right support from your community, right? So we can help you go along the journey. We always think of Evva and what we're building is really as your guide, right? As a guide from beginning to end. And we like to say
love that. It's
Evva
definitely high impact. Let's go into business model. Why would somebody buy it? And maybe what the stickiness of that business model is.
Mm-hmm. Absolutely.
So you want to take that on?
A couple of different ways of engaging it. We are directly going to the consumers as one of the angles is because for them, for the families, the simplicity of the experience, the personalization of the experience, and sort of like this no headache approach to everything that they need now and in the future is something that they value more. So they can spend more time with their loved one rather than worrying about what they need to do and what they need to look out for. Also, they can be rest assured and go and juggle work. And many of these family members actually also care for multiple people, right? They may be the sandwich generation. You have your kids to worry about, you have your work, and you have your parents at the same time. So that's one is we are trying to de-stress this entire journey for you and be your guide along the way. Also, we are partnering with a lot of different community initiatives and community stakeholders, and that is including your physicians and specialists, your neurologists and geriatricians being one part of it, your community initiatives like Meals on Wheels and others being another part of it, and others as well. And so for them too, it is a little bit easier to plan ahead to how do we properly support this neighborhood that we are in, and kind of like, whenever there is a need for a loved one, how do we lift that weight off the shoulders so that the family caregivers don't feel alone in this journey and are well supported. So that has been one of the reasons. And of course, some of the things that we're building upon over a period of time will be actually able to reduce costs at the same time providing the best possible experience. So that has been our focus, and we are building upon some existing research in that area as well.
Wonderful. Yes, I am the sandwich generation, and I think a lot of your investors on Wefunder are also that way. So definitely that connection is super important. And there are a lot of investors that have already put their money down into you. How has that investor journey been? Because I think you are full of empathy. You're building something very impactful, right? So what have you heard from investors that say, I want to invest? What is that kind of piece that they're really looking after?
Yeah, so I think one of the differentiator for us is not only we're looking after the patient, right, but also we're looking after the caregiver themselves, right? Too often, you have solution that just like looking at the person that has the disease or that's managing the disease, and forgetting about the family, right? And they're excited and says, hey, it's not only for my loved one that I'm caring for, but also for me, because I'm aging as well, right? We have one of them, I won't share her name, but maybe she'll mind or doesn't mind. But anyway, she already invested. She's taking care of her 94-year-old mother, right? And also has children of her own. And she's looking definitely. I mean, she said, "Hey, Carl, I'm excited about this. I want to use it for my 94 years old mother, but also as I'm aging, I see it as a solution that I can, engage other family members who are trying to
that legacy piece, right? As an investor, saying it's a solution now, but it's a solution for years to come, and we want to be able to invest in a legacy type of solution. Let's kick on over to. I saw that you won a lot of pitch competitions, so that's congratulations. What has been some of that traction from those pitch competitions that you're like, wow, I got connected to this person and that person and this partnership? We always love seeing that because that allows us to know you are the right founder who is determined and gritty and won't say no for an answer and goes and plows through things. So just kind of an insight into that pitch competition win would be fantastic.
Oh yes, for sure. And I'll say a quick thing is sometimes when people will say, "Well, are you always on?" Right? And I'm like, "Yes, we are always on." Right? And you never know. You can't say no to an opportunity. You can't say no because you never know when the opportunity may come. And I'm at dinner. We are at dinner tables having conversation about Evva and having over brunch, New Year's Eve, and things like that. So we're always on and super excited. Regarding going back to the competition we've won, right? That's been a validation, right? Validation for what we're doing. Too often as a team, right, we are in our little world, right? Very focused and trying to determine and figure out. I think it's right. I think it's not right. Let's figure it. Let's change this. But it's always empowering. It's always it's add fuel to our fire, right? When we go out there, present the solution, and for folks to come to us afterwards, say, hey, this is something innovative. This is something transformative. The way you're approaching, approaching the problem, right? So, yeah. So I'll let you. Sorry, I'm getting excited too.
And I think in the spirit of community, right? I think it has been like to Carl's point earlier. The passion that many people, the passion with which many people have approached us has been amazing. We already have discussions ongoing with a few other stakeholders and senior leaders who have been in the space. And again, in the spirit of community, who are trying to understand what is going on in different areas and how best we can support these families, right? And themselves, of course, in this aging journey. And so that insight, as well as that support, as well as connections, has been wonderful, and we look forward to carrying that forward.
Yeah, I hear a huge market validation saying, yes, we have a market. Yes, we have an innovative product. So wonderful. And the last bit in our last 30 seconds, your team has incredible bench strength between the two of you, and also reporting on Wefunder, what people say about you, how you show up, and you listen to your investors, you listen to your customers. Anything else about your team that you would love to highlight in the last 30 seconds?
Yes, I'll say, we are a village, right? We're building a community ourselves, right? So, and it takes a village to tackle healthcare. It takes a village to transform the experience for families. So as we move forward, we're looking to our community, right, for members of our community to join us in our journey. And that's one of the reason, two members of our community of investors will be selected, right, to join our advisory board.
Wonderful. Well, thank you so much for being part of today. We had a great discussion.